Happy Monday, Decatur. This week we are still anticipating the rise of cases from the Thanksgiving holiday. Over the past 14 days, we've added almost 1,500 cases, and we're expecting more. On Friday, we topped our highest single day increase with 147 new cases of COVID. I know you're tired of hearing about COVID-19, but it's important that you know that this is a marathon. We must keep the faith. Today we have two brave frontline fighters joining us for updates. We have with us with the Alabama Department of Public Health, Administrator for the Northern District, Michael Glenn. Michael, thank you for joining us again. It's good to have you back. And then we have Decatur Morgan Hospital President, Kelly Powers. Good to have you with us again.
Thank you.
Yeah, you're doing quite a bit of speaking these days and trying to educate folks.
Yes.
And thank you for doing that. Appreciate
Yes,
that.
Thank you.
So just a few updates. We currently have 6,818 confirmed cases in Morgan County, which is a 9.95% weekly increase. Our 14-day positive rate for Morgan County is 47%. Over the weekend, we added 335 cases. With cases on the rise, it has never been more important for you to give great thought and consideration to how you'll be celebrating the holiday season safely. We know that even in the best of times, holidays can be tough for many. And as we say every week, remember to check on your friends and loved ones, especially on our young people and elderly residents. If you know someone who's having harmful thoughts, contact the National Suicide Prevention Lifeline. Trained crisis workers are available to talk 24 hours a day, 7 days a week. Now, we share this number every week. We're going to do it again. It's 800-273-TALK. That's 800-273-TALK or 8255. As always, if the situation is potentially life-threatening, do not hesitate to call 911. So, Michael, we'll start with you today and get an update, if you will, from the Department of Public Health.
Thank you for having us again. As the mayor said, the numbers do not look good, both locally and statewide. Over the last 14 days, almost 1,500 cases locally, and we've been averaging about 3,200 total cases statewide for the last 7 days. And that's not 3,200 for the 7 days, that's 3,200 cases each of days for the last 7 days. And so the virus is rampant not only locally but also statewide as well. Our hospitals are full, as you know. I looked this morning, and just to give me some clarity on where we are compared to where we were on November the 1st. We had a total of 973 people statewide that were hospitalized for COVID-19. Yesterday, statewide, it was 1,927. So that's almost 1,000 additional people in the hospital in just a few days, over a month's time. And so our numbers are extremely high. Like to give a little bit of good news. It's always gloom and doom. It seems like when public health comes and we give the updates on the numbers. You know, we just came through the Thanksgiving holidays and looking forward to Christmas and stuff. And we do not only statewide but locally have so much to be thankful for. You know, this time last year, probably not very many of our citizens even knew what a coronavirus was. We probably never heard that term before. And we went from not knowing anything about this new novel virus to being able to test millions of people. We've developed a test to be able to test this. The therapeutics have gotten so much better. Our doctors and nurses have done a phenomenal job of treating this disease, and those folks are extremely tired right now. And so we need to do our best to fight it with what we know works, with masking and social distancing and hand hygiene. Just in a very short amount of time, we're going to have a vaccine, and I know there's a lot of debate about that, but that's going to help our frontline workers and those that are most vulnerable. So we've got a lot to be thankful for at this point in time, and I just want us to be mindful of that, to be mindful of others as we interact with one another, to stay social distance as we can, to wear our mask when we're in confined spaces, and also to make sure you do good hand hygiene. And so we'll be available for questions if you have anything after this.
Thank you, Michael. Thank you. So, Ken, before you start, and I know you have some notes and things that you want to read, but we have those that are tested and positive, and then those that get to a point to where hospitalization is required.
Yes.
What kind of triggers that being admitted to the hospital?
Usually it is your oxygen saturation, people that can't breathe. So, along with, some other symptoms that can kind of get out of line, but usually people just can't breathe, Mayor, and they get to where, they're struggling to breathe, and we have to put them on either high flow oxygen, a BiPAP, or a ventilator to
Okay.
help them breathe.
So we've talked about this before. People can be as skeptical as they want to be about the virus and vaccinating and things of that nature, but you cannot argue the number of people that are in a hospital because they cannot breathe.
No,
There's just no argument there.
there's no argument there, or the deaths that we've seen from it, so.
Yeah, and the stress on our healthcare workers.
Yes, and I think that's, the main thing that I want to talk a little bit about today is the fact that, and I always use my children as examples. Why is it such a big deal? I get it, Mom, and if I were to get it, I'd be fine. But if you give it to someone else who does have a lot of underlying health conditions and they end up in the hospital, we only have so many ICU beds, so many ventilators, and so much staff, including physicians. And that's the point we are today, Mayor. We have 78 inpatients, which is an all-time high, 4 PUIs, 14 in the ICU that are positive, but I've got 25 in the ICU, and we only have 19 ICU beds, so we've had to make some additional ICU beds. We have 11 people on ventilators. We borrowed 2 ventilators from Helen Keller. We have 16 patients on BiPAP. And BiPAP, those 16 patients are just a little bit away from getting on a ventilator.
That's forced air, is that?
It is.
Okay.
Mhm. So they're at the point, they could go either way. They could improve and get off BiPAP and just be on oxygen, or they could get on a ventilator. And one of the reasons I was running a little late this morning was trying to get a little more information. I got 2 patients that are probably going to get on ventilator soon. So that would put me at 13 on ventilators. Again, 25 in ICU. We're keeping elective surgeries this week because we don't have very many inpatient elective surgeries. A lot of ours are outpatient, but it does stress that as well. And what happens there is I'm going to have to make some ICU beds in my PACU area and can only make so many there and use that staff to do. That's why we have to stop elective. It's not necessarily PPE or the ORs or anything like that. It's having to take the staff that would be working on surgeries and use them as ICU staff with that. We also got a call yesterday from a hospital in Georgia trying to transfer a patient to us because they're out of ICU beds. I'm not sure where we are this morning in the state of Alabama, but we have to be getting close to not having enough ICU beds. We have 26 positive employees and 46 on quarantine, and that continues to be an issue, having enough staff. So one of the other things I wanted to talk about was if there's any retired nurses or retired physicians that would like to come back and help, we would love to do that, and we would work with you if you could only work a few hours just to give somebody a break, because it is really stressful right now. The other thing I wanted to discuss is we have a lot of nurses in the state of Alabama, not just North Alabama, leaving to travel. So we had someone who said they could go to California and make $70,000 in 6 weeks. And I'm not putting this out there for people to go. I'm putting it out there to say this is a dire emergency for our state, and I think that you need to do what's right for your state and your community and work here. It's not all about the money, but we need people to work, stay here and take care of our family and our co-workers here in Alabama. So I just wanted to say that, Mayor, that, I know money is important, but it's not everything, especially when people are dying in your community. And right now in North Alabama, I think we're seeing about a death a day. So that's alarming.
It is. Thank you for sharing and bringing attention to the need for continued sustained workforce here in our
Yes,
area,
we do.
especially, and then reaching out to those that have retired and maybe still available to get out and work.
Yes,
So.
thank you.
All right, so do we have any questions?
I'll start with Michael, if that's okay. You guys are in charge of distributing the vaccines. Can you talk a little bit about how that process is going to work?
Well, actually, next week, the 16th, the first shipment of that Pfizer vaccine is supposed to be to the hospitals. It's actually not ADPH that is giving that vaccine out. It's actually coming through the supply chain, and so we won't actually be involved in that, the distribution to the hospitals at that point in time. From that point on, every week after that, we're anticipating more vaccine coming out. The Moderna vaccine's coming out the week of the 22nd through the 24th, and also another shipment of the Pfizer vaccine, and then weekly after that. And so we hope that the supply chain opens up and there's more vaccine available, especially to our frontline workers and those in long-term care facilities.
Are you anticipating it being a couple thousand each round? So like the 16th to 6800
Yes.
for the Huntsville Hospital system. Every week, can we expect thousands more?
Yes.
And people were concerned about that 6,800 number.
Yes, the statewide, the Moderna vaccine is in excess of 80,000 doses coming out the very next week. Pfizer will have another 20 to 40,000 doses of that, and so that'll be like that weekly after that. And so we anticipate that hopefully if the supply chain stays open, that we'll see those kind of numbers each week going forward.
47% is pretty close to 50%.
Yeah, absolutely.
positivity.
Yes.
If I was going into surgery, I would not want 50% chance odds of living.
Me either.
Tell me how serious that number is.
It's extremely serious, not only for Morgan County. We talk, and we're dealing with Morgan County today, but all of North Alabama is extremely, have a high positivity rate. 3 of my 12 counties have a positivity rate of in excess of 50%. And so Morgan County is getting close to that number as well. And so it's not just in Decatur, it's not just in Morgan County, it's a North Alabama issue right now. And so as we're traveling around, this virus doesn't see county lines. And so if we're traveling around and we're in close proximity to other people, if you're breathing and you're in a room with another person breathing, you have the opportunity to get this virus.
I saw that Jackson County is third in the nation per capita.
Yes. This morning, Jackson County is testing for the last 14 days at 51%. Marshall is at 54%, and Marion County is at 50%. So those are my 3 in my 12 counties, and then we have another 3 that are in excess of 40%. Decatur's approaching 47.9 this morning. And so the virus is rampant in our communities, folks. And so whether you want to believe it or not, our hospitals are full. If you go to any urgent care in the mornings, you see a line outside waiting to get in. The health department's testing is high over the last few weeks. And so we're in a very serious position. And in the next few weeks, next month to 6 weeks, I don't foresee these numbers going down any. There's been nothing to elude me to think that anything's going to change over the next 4 to 6 weeks if we don't change our behavior. We have the capacity to change this. Back in July, when the mask mandate first came out, and the social distancing was being pushed, and we came down. We saw those numbers start coming down, and they continued to stay down for a while. And then at the beginning of October into November, we start seeing these numbers shooting back up again. And so we have the capacity to change this in and of ourselves if we will just do what we know works.
Can you talk about, I guess you guys have said masking, social distancing, sanitizing for so long. At
Yes.
what point is that not going to work? I mean, I hate to say that it's not working, but our numbers are continuing to be so exponential. At what point does something else change?
It's not working because we are not doing it. You know, as I was out this weekend doing different things, I saw in a big box store, they are actively pushing for everybody to be social distancing and wearing masks when you go into a business. I went to a restaurant to pick up some takeout, and I was just watching people. Those servers were wearing a mask, and they were trying to stay as far away from people as they could. They had places in between the tables. But when we get in group settings, whether it be in a business meeting, whether it be at church, whether it be at a funeral, a wedding, or whatever distance, just because you know somebody doesn't mean that you can't get a virus from them. And so we are not, the masking and social distancing and hand hygiene work if we do those things. We've seen where those things work back in the late summer, early fall. It's not working now because we're not doing it.
Last question for you and I. You and I talked about this last week. There's been a lot of comments made that the media is over-exaggerating this virus. Let's address it.
Well, if you guys are in the business of trying to scare people, it's not working because nobody seems to be scared of it right now, except those frontline workers who are facing it every day. If you talk to the doctors and nurses that are handling those sick people at the hospital, they see how this virus is ravaging those patients. Those families that have lost loved ones see how this virus is ravaging families. And so we need to take this serious. It's a serious thing. The vast majority of us that get it will probably recover, and we will do well if you don't have any underlying conditions. If you're under 65 years old and relatively healthy, you're probably going to do pretty well. But for the vast majority of people, we know people who are over 65, who all have comorbid conditions. We know those people, and I would hate to know that I was responsible for giving one of my loved ones this virus that could be very easily, we have the capacity not to spread this virus if we'll just do it, what we know works.
Thank you. Kelly, a couple questions for you. 11 people on ventilators, that's easily the highest you've ever had. I think maybe double. I think you had 7 or 8 last week, so this is significantly more. Tell me why you think you're seeing more people on ventilators this week than last.
Well, I think I shared with y'all a few weeks ago, once you get hospitalized and we get an increase in the inpatients, then over time we see more and more of the disease it really works on your body, and we see more and more rise to have to get on the ventilator in order to breathe. So once the hospitalizations go up, give it 4 or 5 days, and your ICU stay and ventilator associated goes up.
And once you're put on a ventilator, the chances of surviving the virus become a lot slimmer. Can you talk about that?
Yes. You know, being on a ventilator means that you can't breathe on your own, and so the ventilator is actually having to breathe for you. And again, that's just, you know, again, I'm not clinical, but that's when we see, you know, the turn in the patients with that.
So when I can think about hospital stays that I've had that was not respiratory related, but the respiratory therapist would come by and visit with me and have me blow in this thing to keep the ball floating.
Yes.
So that I wouldn't catch pneumonia.
Right.
And that's kind of what ends up, if you're in a bed and you have respiratory, they've got to make that ball float, but you're still in the bed, and that's kind of what leads you to that?
It is, yes, yeah. You know, immobility, you know, laying flat for a long time causes you to not be able to breathe as well. And then this virus attacks the lungs. So that's where we see it, just a lot like the pneumonia too. It increases your risk of getting pneumonia as well.
Would you say that you're seeing people become sicker than before?
No, I think just more of them. Yeah.
Talk to me about a little bit about what preparation you guys are doing for the vaccine. Obviously, Friday the system announced you guys are getting the first round in a couple of weeks. What preparation are you guys going through right now to be able to receive that vaccine?
We are all working on a vaccination plan, a way to track every person that has it, because again, you have to get the second dose as well. So working on that, and just a way to get the first frontline staff and our physicians, and then the first responders, and then another way I guess it's in waves. It's like 1A, 1B, all the way through with ease. You know, I'd like to be able to maybe do some kind of drive-by eventually for people to get the vaccine quickly so that we can get a lot of people through.
I know you had mentioned that a lot of people are not going to want to take the vaccine. I've seen a lot of interesting comparisons on social media with, you know, you eat Kraft singles mac and cheese, or like the single cheese, you know, you don't know what's in that.
That's
and you're
right.
Scared, and you eat that, but you're scared to take a virus that we know what's inside of it. So I guess, what is your message to people who may be skeptical of putting something like that in your body when, you know, a lot of our kids go to public schools, you have to be vaccinated to go to public schools. This is just like mumps or polio or anything that could have come out for a mass virus that's happening or has happened.
Well, and I think you have to look at the alternative. You know, if you don't take it, then what happens when you get it or one of your loved ones gets it? So I think when the physicians say they'll take it, then that really gives me great comfort that they've studied it. And I know we have 2 physicians already on our staff, highly respected individuals who have said, I want it when it comes out. And so that gives me great comfort knowing that they've studied it and they feel good taking it.
What is your biggest concern right now?
The increase, you know, more and more not having enough ICU beds and enough staff. I did want to mention there is an outpatient infusion that we can do. We started doing it last week. If you test positive and you're over 65 or have some kind of comorbid condition, Hypertension is one, so I would qualify for it because I have high blood pressure. You can take this monoclonal therapy, say. Is that right?
That's better than I could have done.
Okay. And it will hopefully keep you from being hospitalized. And I just want to put that out there for our community. We have the medicine. We're ready to give it to you. It takes about 3 hours outpatient infusion. You have to test positive, but it could save your life. And so I would love to see more and more people, more and more physicians refer people to us to have that done at the hospital.
And then last question for you. Do you guys have a plan in place, or have you been discussing alternatives for when you can't treat any more cases? Like you said, someone from Georgia had called you guys to see if you had room. Obviously, you're not in the position to take other states' patients. What happens if you or anyone in the system gets in that situation?
Well, we have a surge plan, and we currently are working on getting everything ready for that at Decatur, and then we have one as a system. So we would come together. There's various plans out there, but we may have to have the VBC in in Huntsville open up to have patients. So there is a surge plan out there in case we need it. But currently, we are getting our PACU and other areas ready in case we need to put ICU patients there. So that's our next step.
So other areas, and then
The
last
system.
resort, VBC.
Yeah.
Okay, thank you, Kelly.
You're welcome.
Couple questions, Mayor. Have you talked with other city and county officials about putting in stricter guidelines? It seems every Monday this just gets worse. And nothing besides, masking and social distancing is in place. Have you had any of those discussions?
Not last week, and I think the new order will expire. The order will expire on the 11th, and we normally have a call with the governor prior to that, so I would expect to have something earlier this week.
So then let me ask you this, if she does not put in stricter guidelines, are you considering anything like that in the city of Decatur or the county, considering I think we're number 6 or 7 on the list for the highest positivity rate in the state of Alabama?
Not at this time.
Okay. Anything that you could think of, or you're not going down that route?
Well, I just think that you can listen to the left and the right, to the experts that have shared with us this morning. Group gatherings, we need to do everything that we can to stay away from those. Sherry and I have gone back to worshiping online. We're not eating out in restaurants. We're picking up, eating at home, still trying to patronize our restaurants. It's just those things. And then, of course, the mask and everything that we've talked about.
So tell me a message that you have for your constituents and the people of Morgan County who are still going to church gatherings, are still going to in-house gatherings of more than 10 people. What message do you have for them to kind of maybe try and get this under control?
Listen to what Kelly was sharing, please. Or you can become positive. You can end up in the hospital. You can end up in a ventilator. And sadly, we've seen the fatalities increase in our community, and we don't want to see that happen with our constituents, our friends, people we love and care about. Okay? Here's the thing. We have hope, but that isn't a strategy. We know there's a vaccine coming, but we must take safety measures to protect ourselves. Please do your part so that we can reduce our numbers and alleviate the strain on our healthcare system. Together we can do this. Now is the time to double down. If you have business with City Hall, we encourage you to go online, visit our website at Decatur, cityofdecatur.al.com, and there you can call the city departments and take care of a lot of your business online. They will help you in doing that. Beyond that, our next press conference is scheduled for Monday, December the 14th at 10 o'clock, and we'll see you then. Thank you.
Thank you.